Welcome back to Simply Women's Health with CJ. Today we're going to talk about colposcopy. A colposcopy is a procedure that is done to evaluate abnormal cells that are growing on your cervix. So just as a quick review, the cervix is actually at the very end of your uterus. It is the part that is within the vagina. The uterus is back up in here. You can get abnormal cells on here, and when you have a pap smear, that is what's called a screening exam. They just put a speculum in, they gather up cells from your cervix, they send them off to pathology, and they see if there are any abnormal cells growing on the cervix. Pap smears are not what are called diagnostic, they are screening tests. The colposcopy is actually to make an actual diagnosis of cervical cancer. So you found out that you have abnormal cells, you have been sent to a gynecologist or somebody who has been trained in colposcopy. When you come in, they are going to want you to do a pregnancy test. I typically tell my patients to abstain from unprotected sex for 2 weeks prior to their procedure. I also encourage my patients to take something that can help with cramping, whether it's ibuprofen, Tylenol, naproxen, whatever is your drug of choice. The procedure itself isn't painful. It's not comfortable, but it's not painful. But if you have to have a biopsy, that can cause some crampy feeling in your uterus. So you'll come in, they'll do a pregnancy test, and hopefully they'll explain to you exactly what's going on, and then you will need to sign a consent form giving your provider permission to do the procedure. So the way I usually tell my patients, I'll sit down and explain to them exactly about their pap smear results and how that works. If you haven't already seen my pap smear video that talks about abnormal results, that can be helpful if you have any questions about these results. So the way that the cervix is built, the cells start out at the very bottom of the cervix. They start out big and round and fluffy. They migrate towards the top of your cervix. When they get to the top, they come through this endocervical canal and they come out here to the edge and then they die off. It typically takes the cells about 2 years to get from here to here. The cells in here are called columnar cells. They are in a column. They are the newest cells. When they come out through the endocervical canal, they migrate out towards the edge. When they come out here, they become squamous cells. The difference between a squamous cell and a columnar cell is the squamous cells actually have a protective coating on them so the HPV can't get in there. So the first thing your provider is going to do, they're going to put the speculum into your vagina and they're going to get your cervix into view. They're going to look at your cervix with a standing microscope. They're just going to take a look. The first thing they're looking for is this transformation zone where the cells are transforming from columnar cells to squamous cells. Once they see your transformation zone, they're going to put a little bit of vinegar on there. The vinegar, some people say it's cold, some people say it stings. Most people say they don't feel anything at all. The vinegar actually reacts with human papillomavirus and starts to glow white. You'll get white cells that'll show up on your cervix. Then your cervix, again, after they soak it with the vinegar, and the vinegar, again, has to sit on there for about 1.5 minutes, so be patient. Then they're going to look again with the standing microscope and see if they see any cellular change. If they do see something, some providers will use another solution called Lugol's. Lugol's is a high-potency iodine. The thing I like about Lugol's is it helps clearly define the borders of if you have any lesion in there. If they see anything that looks suspicious, so when we're looking, we look for what's called acetowhite epithelium. That is changes in the cells on the cervix. If it's really mild, it kind of looks a little bit like wispy clouds. The more severe cells are going to have a lot more definition, and they're going to be a lot more kind of like thunderclouds, where they just have a lot of they're very thick. We also will look for what's called punctation, where it looks like somebody took and poked a hole throughout your cervix. There's another thing called mosaicism, where we look at your cervix and we look for what looks like a mosaic tile pattern. We can also flip the Colpo machine over to a green light. Green light helps identify any abnormal blood vessels. Remember, cancer needs blood flow to grow, so that's usually one part of that. If they see anything suspicious, they may take a little bit of a biopsy. A biopsy is no bigger than a grain of rice, and they send that off for pathology. Now remember, you have abnormal cells growing inside your cervix, so another part of the procedure will be what's called an endocervical curettage. They'll take a stick about this long, it has a basket at the top, you go into the cervix, so you're going down in here and you're gathering up those cells. That is the part that is very, very uncomfortable, which is why I usually recommend my patients take something before they come in. If you are pregnant, you can still have a colposcopy, but they cannot do the endocervical curettage, which is why it's really important to not have any risk for pregnancy when you come in. They send the cells off to pathology. The pathologist will come up with a diagnosis. The diagnosis is going to direct what the treatment plan will be. If you have mild or what's called stage 1 or CIN1 cells, typically we just repeat your PAP again in a year. If you have moderate or severe cells that are within the biopsy, your provider may recommend that you undergo a procedure to have those cells removed. Hi, if you're still here, thanks so much for sticking around through the entire video. If you feel as though this information has been helpful to you, or you think you know somebody that might benefit from the information provided in these videos, please feel free to like it, share it, and if you haven't already subscribed, I would love it if you did that. Any and all support that you can provide is so greatly appreciated. As always, these videos were not created as a replacement for a visit with your healthcare provider, rather as a place for you to come for basic, reliable information that is non-biased and hopefully allow you to figure out what questions to ask your healthcare provider at your next visit to best meet your healthcare needs. Again, I appreciate all of your support. If you want to contact me, my information is at the top of this screen, and I will put it in the comment section of this video. That's all I have for today. This is CJ. I'm at your cervix.